Well, hello, Facebook. Welcome back to Colorado Springs School of Massage. My name is Joe Alberto, the director, and I've got all kinds of information to share with you. And you saw our model here, and I brought the model out because we're going to start this month a series on different parts of the body. And I want to educate you about all the different things that we do to teach our students how to work on these areas. And I'm going to drop this down a little bit so you can understand what I'm saying. But how many of you are good at doing a neck rub? I think everybody can do a neck rub. And let me show you, when we're doing a neck rub, we're addressing this part of the body. And this looks kind of simple. And yeah, well, this part is kind of simple. But I want to introduce you to the different layers of the body. Check this out. As we start working a little bit deeper than just that first layer that I showed you, that was the upper and middle and lower trapezius. Very strong muscles. We all use them. They always need to be rubbed out. But when we start having problems with headaches, when we start having problems with limitations in range of motion and we can't move our head around, we start looking at the deeper layers of the body. And so we're talking about the levator scapula. We're talking about the splenius capitis, the erector spinae. Lots of those muscles are very complicated. They work together. They work opposite, and they work in teams. And so it's very important for us to start learning about the different layers of the body so that we can start being more effective in relieving somebody's headache or somebody's tight neck. Or heaven forbid, you're in a car accident. We could be involved in a car accident and get that condition known as whiplash. Many different parts of the neck are involved in that. And depending on how the car impact happened, and we'll talk about this a little bit later in our next segment about symmetry and asymmetry and balance between sides. First, we have to start learning about the different layers of muscles and the different muscles that are involved. So we've got the first layer, the upper trap. We've got the additional second layer of muscles. And then when we really start getting technical, the deepest layer of muscles all the way down to the spine. We're talking about muscles that move individual bone segments in the cervical and the thoracic areas. All of those things need to be addressed, and they need to be addressed carefully because there's lots of nerves that pass through these areas. There's lots of vascularity that passes through these areas. And my students know that yes, there are endangerment sites that you have to be careful about. You can't just go poking around in the neck anytime you want to willy-nilly. But when you understand how to work the different muscles, when you understand where the danger zones are and how to navigate your way around in there, then we can start being really effective at working with the neck and the associated injuries that come with it. So before I get too much farther, anybody have any questions? Anybody
Well,
watching yet?
there's a number of people watching, Joe.
Oh, good.
Absolutely. Yeah, yeah. We just got a thumbs up on this last comment.
Awesome.
Joe, for the audience, one thing occurred to me. What about people that they like massage, they haven't gone to school? I get the impression that this knowledge base you're talking about is going to make them a better massage therapist.
Well, it'll make you a better massage therapist, but what I'm actually intending to do is to enlighten you when you're working on your husband's neck, or if you're the husband and you're working on your honey's neck. You need to be careful about how you go banging around in there. I know I get a lot of complaints from my customers. They say, well, my significant other was working on my neck, but they hurt me. They went too deep. Or they only worked it for 2 or 3 minutes and now they're tired. And so, from an instructor perspective, I want to show you how to do the massage and not wear yourself out doing it. So, you can do neck and shoulders for an hour. Oh, yeah, you could really do that. Now, the receiver probably doesn't want that much treatment, but if you know how to do it, you can go on and on and on. But I also want you to understand the different areas of the neck that need to be addressed, how to address them, and when you need to be careful, and maybe when the best time is to send your honey out to a professional to get their neck rubbed correctly so that they get a good result and not a sore result or bruises or not really like what you did. Yeah? You got a smirk over there?
No, well, I have a smirk. I was just thinking about how people sometimes go too far, and then they need to know when is the point that they should go to a professional.
Well, that's an excellent question and a good observation because if it's just a little sore, sure, have your honey rub it out for you. But if you're having difficulty turning your head, Now we're talking about a more complicated situation. If you get into a car accident, definitely go see the medical professionals. Go get yourself a professionally done massage. Soft tissue damage is typically what your doctor is going to tell you you have. And guess what soft tissue is? Muscles. That's what we deal with. So we can really help you recover from a car accident very quickly and with a relatively quick observation of, wow, that feels better already. So check that out. When we're talking about car accidents, we're talking about the deeper layers of muscles, these guys in here, and if you could read those labels on there, man, it might as well be Chinese, but all of this comes from Latin, all of this comes from medical language, and so you will find that, wow, do I need to know all of that stuff before I start rubbing my honey's neck? Well, you don't necessarily have to know it all. Let me show you over here a little bit. Let's turn this one around. Remember upper trapeze? Yes, that's in there, middle trap, and then we go down to the lower trap. But on this side, the trapezius has been removed. And you start seeing some of the longissimus capitis and the splenius capitis muscles. You start seeing the scapula. You start seeing, and here, sternocleidomastoid. And I know I'm geeking out on the terminology here. But this yellow stuff here, nerves. You got to be careful. If you're working on these muscles, you could be banging around on nerves, and you don't want to do that. As we come a little bit closer to the front, look, the blue, the blue and the red, that's vascularity. We're talking about blood supply. You don't want to cut blood supply off to the brain because your honey's not going to like that too much either. But look at all the complexity that's in there. There's a lot to learn. There's a lot to be cautious of. But I tell you what, once you figure this out, you can be your honey's best friend for massage too. So,
Well, Georgina Mackey-Led is really enjoying this.
hi, Georgie, how are you? Yeah, I see you. I see you. And so you liking this? You gotta check these out more often. We do. Georgie's one of our students. She's a graduate. She's a fantastic massage therapist. If you happen to be in her neck of the woods, check her out. She's really good. I don't know. What other questions? Do we have any questions?
I know, Joe, you mentioned that you do see people walking in car accidents. You told me that you can tell them
Well, absolutely. You should kind of start developing a sight for this. When somebody's walking around like this, once you've learned that this is not normal, you see it right away. You can watch people walk in with a neck issue. You can watch them walk in with a hip or a back issue. It's not hard to tell. It's pretty easy to spot, and it already gives you an idea of what areas of the body are going to need extra attention because of the way that they present. Because their body tells you a story, your mouth tells you a different story, and many times you've got to kind of sew both of those things together as you learn more and more about how the body works. When they're telling you one thing, they may not have noticed all these other things that are splicing into their verbal story, and their body's story is going to be a whole lot different, but it all works together, and we can certainly resolve almost anything at once.
so there's no reason to wait.
No, absolutely not. Matter of fact, in my experience, if you are involved in some kind of trauma, whether you fell and you hurt yourself or you were in an accident of some sort, if you get seen within 3 to 5 days of that accident, of that injury, now, I mean, if you had to go get stitches, okay, let's not go there. Broken bones, you can't do that. But if it's just a soft tissue injury, 3 to 5 days, your first treatment will expedite your recovery by weeks. I've known people that have waited 3, 4 weeks before they got their first massage, and man, their recovery took a lot longer than it should.
Usually us guys.
Yeah, us tough guys are yeah, give me some ibuprofen. I'll be fine. Come get a massage. Don't do that. So anyway, for those of you that are interested in what I just spoke about, want to know more about muscles and bones and how they all work together, and want to go to school, we are enrolling for our October class. We do have a couple of seats left, so no pressure. We're not rushing you, but call us. Find out more about our program. I think you'll like what you hear. You can call us at 719-310-9297. And we're over here on the corner of Constitution and Powers, the new best part of the planet. Anyway, give us a call, and until next week, I'll see you later.